Good afternoon. My name is Dr. Andrew Freeman, and I'm joined today by Dr. Fred Beauvais here at ACC 13 in San Francisco. Today we're going to be talking a little bit about CardioSmart TV as part of the patient-centered care community on CardioSource. Dr. Beauvais, could you tell us a little bit about CardioSmart TV and how it might impact one's practice?
Oh, thanks, Andy. I guess I can start out by saying that we wanted CardioSmart to be the patient-oriented website that allowed us to provide educational information and care information to patients. As the website evolved over time, we realized that there was an awful lot of very good educational information that we could present to patients that didn't have to log on to a computer, look at the website and so on, that we could put this in waiting rooms actually, because our patients are going to be in waiting rooms. So out of that evolved CardioSmart TV, which is an educational TV program that's designed to go into cardiology waiting rooms that runs through about 30 minutes of educational material for patients that are in the waiting room waiting to be seen by their physician.
So if I'm in a waiting room and I want to learn about something in particular, how is that content chosen and how does it get to the CardioSmart TV?
Well, there's an editorial group that does that. It comes from the Patient-Centered Care Committee and the CardioSmart editorial group. They're taking material that they're looking at for CardioSource or CardioSmart, material that a physician might want to give to a patient, and building a whole theme around a series of those. It's a 30-minute educational piece with maybe about a minute to a minute and a half of education that goes through a whole series of different kinds of materials for patients to learn about their heart disease or their treatment.
I think that's fantastic. And so how has this been received by those providers who have tested this and started doing this in their own practice?
Well, we offered it to the membership of the ACC, and so far we have about 2,000 physicians that are using it in their practices, and it looks like it's going over very well. The patients like it. It's got educational information for the patients, and we're seeing a lot of interesting attention to the material by the patients in the waiting room. So I think it's going where it's supposed to go and moving along.
Okay, and for those of us that want to have this in our practice, where do we go? How do we get one? Does it cost anything?
There's no cost. If you talk to the CardioSmart group at the American College of Cardiology, they can link up the people that are needed to get the material installed in your practice site. That is the screens, and this is all over the internet. So there's no requirements for internet connections or anything like that from your institution or from your office. It's all done externally. So CardioSmart at ACC, and then they will follow through and send the appropriate connections through to put this in your office practice.
Well, fantastic. Thanks for joining us today. I think this is a really helpful benefit for members, and I think it really helps to improve patient-centered care. So thanks so much for joining us today.
Good, thanks. I appreciate being here.